Vitamin D fish oil supplements don't benefit cardiovascular health, new study finds. For decades, doctors have been searching for a surefire way to prevent atrial fibrillation. Atrial fibrillation. Atrial fibrillation. Atrial fibrillation 是房颤，心房颤动。Atrial fibrillation, an abnormal heart rhythm that can prove fatal. Now a new high-quality study has ruled out two possible contenders, vitamin D and fish oil supplements. The trial, called Vital Rhythm, took center stage at a recent virtual conference of American Heart Association, the nation's largest professional organization of doctors who focus on the heart and the cardiovascular system. Atrial fibrillation is a very common condition and is hard to treat, said Dr. Christine Albert, the study's head author and chair of the Department of Cardiology in the Smith Heart Institute at Sinai. There are an estimated 33 million people in the world with atrial fibrillation. 房颤有3300万人口。Atrial fibrillation is not benign. Benign 就是良性的。It's not benign. Atrial fibrillation is not benign. She explained, if left untreated, it can lead to serious health consequences such as stroke, heart attacks, heart failure, dementia 是痴呆 dementia, and even death. Although early, less reliable studies hinted that vitamin D and fish oil might help, doctors said this new study shows they don't make a difference. Doctors said it's a relief to see high-quality evidence like this, because it means they can focus on new research frontier and avoid prescribing unnecessary pills to their patients. Prior studies identified a possible link between these supplements and atrial fibrillation rates, but it wasn't clear if these differences were caused by the supplements themselves or by some other unexplained factor, such as lifestyle choices. Vitamin D deficiency unlikely to fully explain COVID-19's effect on people of color. Albert and her research team embarked on a massive study comprised of 25,000 volunteers who would be randomly selected to receive vitamin D fish oil or a placebo pills 安慰剂。Dr. Erin Mikas, the director of Women's Cardiovascular Health and the associate director of preventive cardiology at the Cicaron Center for the Prevention of Cardiovascular Disease at Johns Hopkins University Medical Center, said the study received praise at this year's American Heart Association conference because it was a high-quality study that included diverse volunteers. This means that the findings are applicable regardless of race and gender. They studied vitamin D at 2,000 IU per day compared to placebo, while simultaneously studying 840 milligrams a day of marine omega-3s versus placebo. This was a randomized clinical trial and blinded, so participants could not know whether they were taking a supplement or placebo, Michael said. Historically, large trials have been victim to underrepresentation of lack of diversity, making it difficult for clinicians to apply these trials to their true patient population. This study, meanwhile, represented a larger population of African Americans and women. Michael said that the importance of having a strong representation of African Americans in this trial was critical. Many have lower blood levels of vitamin D as a result of darker skin pigmentation, which led to poor absorption of UVB light, 紫外线 UVB light, which is necessary to create active vitamin D and utilize its benefits. I actually applaud the study investigators for their effort in diversity in this trial. My course said 20% enrollment of black means they were overrepresented relative to their proportion in the US population. In addition, Michael said that women are frequently underrepresented in cardiovascular trials, which usually limits doctors' understanding of whether a drug or treatment will work just as well in women as it does in men. However, this was not the case in Vital Rhythm trial. My course said the Vital trial enrolled 51% women. In recent years, research has shown a behavioral shift among some Americans toward a rise in the consumption of supplements. An estimated $120 billion in this industry. But the researchers say the true health benefits of supplements are often overstated. For the vast majority of supplements, there doesn't appear to be any benefit. Again, more is not better if one does not have a nutritional deficiency. Some high-dose supplements can even cause harm. The evidence is growing that supplements do not prevent primary or repeated cardiovascular disease. Another study, debut AHA, the OMI trial, showed no benefit in adding marine N3 polyunsaturated fatty acids supplements to prevent a second heart attack. But what has been shown repeatedly is the benefit of diet and exercise in preventing, or at times even reversing, conditions like atrial fibrillation. We tend to look for the magic nutrient, so we do not have to eat good food. 5 ways to protect yourself from heart disease during American Heart Month. Albert said the most effective prevention is maintaining a healthy weight, reducing alcohol intake to 1 to 2 drinks per day, and maintaining a healthy blood pressure. My course agreed. She advised that a healthy lifestyle and dietary behaviors can prevent not only atrial fibrillation but cardiac disease overall. Moderate exercise following a healthy diet, maintaining a normal weight can decrease the risk of atrial fibrillation. I think the individuals would be better served by saving their money on supplements which have not been shown to work and instead focus their time and money on activities that promote a healthy lifestyle.